While we are busy in our lives, it is important to have a close and trusting relationship with our bodies. We can start by understanding what our body is telling us through small signs and symptoms and listening to even the slightest of signals. At Promote Health and Wellness, we have decided to tell you about which body signals should definitely be paid closer attention. 1. Dry or cracked lips. Flaking dry skin is a clear sign of an allergy. In this case, pay close attention to the cosmetics that you use as well as oral hygiene products, food that you eat, and even medicines. Cracks in the corners of the mouth indicates a lack of vitamin B, A, and E. If you also have a dry eyes, a dry mouth, and problems with your digestive system, you would better visit a doctor because it can be a combination of symptoms specific for an autoimmune disease called Sjogren's syndrome. 2. Nail dystrophy. We are all aware of how healthy nails can look. Any change in their color or structure, it is an alarming signal. Thin and pale nails can be a sign of anemia and lack of iron in the body, while yellowing can indicate liver and gastric tract disorder or fungal infection. White spots and stripes indicate a lack of zinc, copper, and iodine, and the nails can become very brittle when faced with a lack of vitamins, calcium, iron, and beta carotene in the body. 3. Pale lips with bright contour. There are different explanations for various illnesses. If the red border of the lower lip becomes swollen and there are small bubbles that appears on it, it is likely that you are very sensitive to ultraviolet rays. What you can do in this situation is decrease your exposure to the sun with the help of sunscreen cosmetics. Severe swelling and redness of the entire lip indicates an allergic reaction. Pay more attention to your cosmetics and toothpaste and visit an allergologist. 4. Red face due to hormones. We exclude natural physiological changes such as changes in temperature, massage, or alcohol consumption. There are three widespread reasons for getting a red face. For women after 40, it is due to a decrease in hormone levels, indicating the beginning of menopause. A red face can also indicate the presence of infection that cause demodicosis. A partial redness that goes together with sudden attacks of dizziness can signify pressure fluctuations that can be normalized with the help of special medicines. 5. Dry heels. The skin on feet gets dry due to the lack of vitamin A and E. It can also be caused by a presence of fungal infections that affects the overall conditions of the epidermis. The last case usually goes together with the numerous cracks and the yellowing of nail plates. If dryness and roughness don't disappear even with the proper care and adequate intake of vitamins, this may be a sign of endocrine disruption. 6. Eyebrow loss. Not only are thick brows a current trend, but they are also a big health indicator. Periodical loss of eyebrow hair is quite normal, but if you notice an excessive loss of hair, as well as the appearance of bald spots or even a complete disappearance of the eyebrows, contact doctor immediately. It can be connected to an excessive or insufficient level of thyroid activity. 7. Foot deformity. The displacement of foot bent inward and a change in the shape of the foot, which is characterized by the omission of longitudinal or transverse arches, usually indicates flat foot. According to statistics, transverse flat foot combined with other deformation occurs more often than longitudinal flat foot, and it's women that are more vulnerable to it. The reason for this is due to wearing high heels, causing an uneven load distribution to take place, putting the biggest load on the area of the transverse arch. 8. White stains on the teeth. Dental fluorosis is a chronic disease that develops either before teething or after when consuming large amount of water or products with high content of fluorine compounds. There are five types of fluorosis classification: questionable, very mild, moderate, and severe. The first three variations manifest usually through the appearance of stains, while the last two lead to decaying teeth tissues and teeth crumbling.